You might be curious about how your feet could possibly relate to the health of your liver, right? Well, believe it or not, your feet can display some pretty important clues about what's happening with your liver. Now let's learn about why this matters. Our liver is like a behind-the-scenes superstar, working hard to detoxify our bodies, help with digestion, and so much more. So if our liver starts waving a red flag, it's not just a small hiccup. It could affect our whole body's well-being. If we don't pay attention to these warnings, we're looking at potentially serious stuff. Think about conditions like cirrhosis, hepatitis, or even liver failure. Yes, it can get that serious. So you're probably asking, what exactly should I be looking for on my feet? We're going to cover all the bases from swelling to unusual skin color changes, and we'll make it clear how these signs could be the liver trying to send us a message. Spotting these signs early on is key. It could make all the difference in tackling the problem head-on, way before it grows into something bigger. Let's keep those feet and our livers happy and healthy, shall we? The inaugural sign to look out for is swelling in the right foot, medically known as edema. This is a frequent harbinger of liver complications. Should you notice that pressing your finger against the swollen area leaves a visible mark, it's due to an accumulation of fluid within the tissues, often a consequence of the liver's reduced ability to manage blood flow effectively. Moving on to the second sign, spider veins. These small web-like networks of blood vessels can emerge on the lower extremities and are often a visual cue of the liver struggling to filter excess hormones from the body, specifically estrogen, which can cause these vessels to widen and become noticeable through the skin. The third sign is alterations in your toenails, which might appear predominantly white or exhibit a curved, club-like shape. Such changes suggest that your nail beds are not receiving adequate oxygen and nutrients, a potential indicator of your liver's underperformance in nutrient absorption. Fourthly, flat purple lesions can appear. These are not just a dermatological concern, but could also point to your liver's diminished function in toxin filtration, leading to skin irritations or indicative of a viral hepatitis infection. Sign 5 involves the integrity of your heels, where cracking may occur. This isn't just a cosmetic issue. It signals potential deficiencies in nutrients like omega-3 fatty acids or vitamin B3, both essential for liver health and preventing fatty buildup within it. The sixth sign is discoloration or staining of the skin on your feet, manifesting as red, brown, or yellow patches. These marks are symptomatic of compromised blood circulation, a condition sometimes related to iron deposits under the skin due to liver malfunction. Sign number 7. Let's talk about itching, specifically under the soles. A congested liver can lead to a buildup of bile salts beneath the skin, triggering histamines to release into your bloodstream, resulting in persistent itchiness. The eighth sign is the appearance of purplish or reddish spots known as ecchymosis. This can be linked to circulatory issues stemming from liver distress, or may also be an early warning of diabetes. Sign 9 involves a sensation of burning in the feet. This can often be a red flag for nerve damage associated with elevated blood sugars or prediabetes conditions, frequently accompanied by insulin resistance and fatty liver disease. The 10th sign is toenail fungus. If your nails have thickened, turned yellow, and become brittle, it could be a fungal infection, sometimes correlated with an imbalance in your body's microbiome and potential liver dysfunction. 11th, we mustn't overlook odors. An unusually foul smell from the feet may be more than an issue of hygiene. It could signify the release of toxins through the skin, often due to fatty liver and possibly linked with gastrointestinal or renal issues. Finally, we reach the 12th sign, jaundice, recognizable by a yellowish hue on your skin or the whites of your eyes. This is a direct sign that your liver is struggling to filter out bilirubin, usually due to significant liver damage. As we cover these signs, I encourage you to augment this information with your own research. However, should you notice any of these symptoms, consulting a healthcare professional is paramount. Remember, early detection can pave the way for more effective management and potentially avert more severe health issues down the line. Now that you are aware of some of the signs and symptoms of liver damage in your feet, let's take a look at what usually causes these liver problems. Then we'll explore 5 steps that you can take to help repair and restore your liver. Firstly, and perhaps the most obvious, drinking alcoholic drinks damages the hepatic liver cells because it has to remove alcohol from your blood. Another cause of liver damage is eating too much sugar, refined grains, and carbohydrates, which all turn into blood sugar. This is the most common cause of non-alcoholic fatty liver disease and is usually accompanied by weight gain around the stomach. No. My exchange. Dilation proceeding to inflammation and potentially leading to fibrosis or even cirrhosis. Together, let's commit to these lifestyle adjustments to support our liver. Remember, the journey to recovery begins with knowledge followed by action. To learn more about this topic, please like the video and subscribe to my Get Fit channel. I want to express my gratitude once again for your viewership and support. In watching this video today, I send my best wishes for you to always be safe, prosperous, and happy.